There's new advice to prevent food allergies in children. Giving a baby a new food to try is fun, and it should be. The only concerns, on Monday, based on a detailed review of all available evidence on the topic, the American Academy of Pediatrics published on what works and what doesn't when it comes to the prevention of food allergies and other allergic conditions. The new guidelines, there is no convincing evidence that delaying the introduction of allergenic foods beyond 4 to 6 months of age works in preventing food allergies, the report says. In addition, the gastrointestinal tract is home to a unique set of immune system cells, and when these cells are given a taste of the allergenic proteins in different foods, they take up these proteins and become tolerant to them. Dr. David Stuck, an early means as soon as 4 months to 6 months of age, said Stukas, who was not involved with the new guidelines. The report also looked at whether breastfeeding protects against eczema, wheezing, asthma and food allergies. Exclusive breastfeeding for the first 3 to 4 months of life was found to be protective against eczema, the authors concluded. Any amount of no evidence was found that avoiding allergenic foods during pregnancy or during breastfeeding worked in the prevention of allergic conditions. Neither did the use of Swanson, who has long advocated for the early introduction of a diversity of foods in young children, described feeling grateful for the guidance, given the ongoing changes in the understanding of allergy prevention. In 2000, the American Academy of Pediatrics recommended delaying the introduction of cow's milk until children were 1 year old, egg until 2 years and peanuts, tree nuts, and fish until 3 years. Recommendations. In 2008, after a review of the available literature, the organization issued a report saying there was no convincing evidence that delaying allergenic food introduction prevented food allergies. The report did not. Almost 10 years later, after a study was published in the New England Journal of Medicine, the Academy recommended that babies at high risk of developing peanut allergies be introduced to peanuts as early as 4 months. Infants considered. This study, known as the Learning Early About Peanut or LEAP trial, showed that children at high risk of developing peanut allergies who are introduced to peanuts at 4 months to 6 months old had a significantly lower risk of developing a peanut allergy than those who waited until they were 5 years. 1.9. The LEAP trial formed the basis for Monday's new recommendations, which encourage the early introduction of peanut products in infants at high risk for allergies. But most babies are not at high risk, and peanuts are just one of the 8 culprit foods. The others are milk. The latest report explains that the same mechanism that protects infants at high risk is likely to protect infants at low or standard risk of developing food allergies. A study that examined these other foods, known as the OR-EAT trial, recruited 1,303 3-month-olds and randomly assigned them to receive 6 allergenic foods: peanut, cooked egg, cow's milk, sesame, whitefish, and wheat at that age, or to wait until 6 months. The team then measured. Only 40% of parents were able to keep up with the diverse food frequency that the study protocol recommended. When researchers looked An important takeaway from the trial is that introducing a variety of foods as early as 4 months is safe, Stukas explained. Overwhelmingly, the data is pointing toward the benefit of early food introduction, Swanson said. In his practice, Stukas has started to recommend early introduction between 4 and 6 months of age of allergenic foods for all babies, no matter their individual risk. He encourages The most serious risk is anaphylaxis, a severe allergic reaction that can be life-threatening. But in most young parents who spot vomiting or hives especially together should still seek medical attention. But pediatrician, no.
Raindrop, drop top, smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park, pot.